Hello, my name is Bruce Agans. I'm an infectious disease clinician, professor in the Division of Epidemiology, and director of HEALTHQUAL at the University of California, San Francisco in the Institute for Global Health Sciences. I'm pleased to welcome you on behalf of the Fast Track Cities program and IAPAC, which has supported UCSF to develop this series of webinars that will address the strategic use of HIV cascade data to improve services across the continuum of HIV care. In these sessions, I will be joined by my colleagues as presenters, including Dr. George Rutherford, Professor of Epidemiology and Biostatistics and the Director of the Prevention and Public Health Group, Hannah Osman Firdaus, a Technical Advisor in the Global Strategic Information Program, and Dr. Joseph Marungu, the Deputy Director of HEALTHQUAL and former ART Program Director for the Ministry of Health and Child Care in Zimbabwe. This webinar has been developed to support the Fast Track Cities initiative. Fast Track Cities is a worldwide movement that seeks to use the unique potential of local communities to accelerate progress toward achieving HIV epidemic control. More than 300 cities worldwide have joined Fast Track Cities. Its primary partners include UNAIDS, the International Association of Providers of AIDS Care, IAPAC, and the UN Habitat. The Fast Track Cities initiative is devoted to optimizing the HIV care and prevention continua toward attainment of the global 90-90-90 targets and the fast track commitments adopted by the UN member states at the UN General Assembly high-level meeting on ending AIDS. Specifically, goals include the increased utilization of combination HIV prevention services, operationalization of global and local treatment policies at the city clinic level, reduction to zero of the negative impact of stigma and discrimination, and the establishment of a common web-based platform for the real-time monitoring of progress. Specifically, the fast track commitments include ensuring that 30 million people living with HIV have access to treatment and eliminating new HIV infections among children. To ensure access to combination prevention options, including PrEP, voluntary medical male circumcision, harm reduction, and condoms, especially for young women and adolescent girls in high prevalence countries and for key populations, including gay men and other men who have sex with men, transgender people, sex workers and their clients, people who inject drugs, and prisoners. To eliminate gender inequalities and end all forms of violence and discrimination against women and girls, people with HIV, and key populations. To ensure that young people have the skills, knowledge, and capacity to protect themselves from HIV and have access to sexual and reproductive health services. To ensure that people living with at risk of and affected by HIV benefit from HIV-sensitive social protection. To ensure that at least 30% of all service delivery programs are community-led, that HIV investments will increase to at least US $26 billion, to empower people living with at risk of and affected by HIV to know their rights and to access justice and legal services to prevent and challenge violations to human rights. And finally, to commit to taking AIDS out of isolation through people-centered systems to improve universal health coverage, including treatment for TB, cervical cancer, and hepatitis B and C. This slide shows us graphically how these results can be achieved following the realization of these commitments by accelerating implementation of activities through the Fast Track Cities initiative, essentially realizing a 75% reduction in new infections. In this series of presentations, divided into 8 segments of 10 to 15 minutes each, we will aim to achieve the following 5 objectives. To describe and define core metrics to be collected for the Fast Track Cities dashboards, definitions of populations, and examples of data sources. To learn strategies to collate and use routinely collected information for planning interventions, and to gauge the progress of the urban HIV response. To understand methods for construction of cascades, to provide information for planning, prioritizing, and designing interventions to address gaps in the care cascade with the aim to improve the quality of diagnosis, care, and treatment in the jurisdiction, and to engage public health officials, frontline health providers, and the community to achieve epidemic control. Before we turn to these modules, I want to provide you with a very brief background about the participating programs at UCSF. The Institute for Global Health Sciences is the home to UCSF faculty who work in nearly every country around the world, conduct research, provide technical assistance, and provide training, all in an effort to advance health worldwide. The Global Strategic Information Program is dedicated to strengthening the capacity of country stakeholders to collect, synthesize, and use strategic information to inform, guide, and monitor evidence-based responses to the HIV epidemic. By providing this support, GSI helps countries control their HIV epidemics and advance toward achieving the 90-90-90 targets. Finally, HEALTHQUAL is a capacity building initiative devoted to supporting the implementation of quality management and quality improvement globally through coaching and mentoring, peer learning, and involving community. HEALTHQUAL makes its home in IGHS and has supported the growth of quality programs across the United States and has extended its work to TB and maternal child health programs and the support of national quality strategies and policies. We hope that you find these webinars to be informative, practical, and hope that they'll contribute to your successes in meeting the fast track goals in your cities and jurisdictions as part of our joint global effort to end the HIV epidemic. Thank you. The 8 modules that follow include: what is epidemiology, surveillance, and strategic information? What is a cascade? How to measure linkage and retention. Other types of cascades, including PMTCT and prevention cascades. How to interpret cascade findings. How to address gaps in the cascade. Using other sources of data to complement your cascade, and how to communicate cascade data. We hope that these 8 modules will be interesting to you and will help you advance your work in moving forward as part of the Fast Track Cities initiative. Thank you.